Hi. Welcome back to Mindflux. Dissociative Identity Disorder, or DID, is a mental disorder that causes people to have more than one identity. It's characterized by gaps in memory and changes in behavior. People with DID may also experience hallucinations and delusions. In this video, we will discuss what it's like to live with DID, overview of the condition, symptoms, treatment options, and how to cope with dissociation. Let's jump in. What is dissociative identity disorder? Dissociative identity disorder, DID, is a mental illness characterized by at least two distinct and relatively enduring identities or dissociated personality states that alternately show in daily life, each with its own relatively long period of time when the person is not present. Dissociative identity disorder is a complex condition that has been associated with traumatic experiences in the past. It can be very difficult to have, and it's important to know what you're going through if this is your experience. What are the causes of dissociative identity disorder? Well, among the many possible diagnoses for this type of mental illness is post-traumatic stress disorder, which has been linked to extensive trauma during an individual's early years. For example, people who have experienced physical and sexual abuse in childhood are at increased risk of dissociative identity disorder. The vast majority of people with a history or poor relationship with their parents are also likely to develop dissociative identity disorder. Let's move to the symptoms of dissociative identity disorder. People who are diagnosed with DID may have different types and intensities of symptoms, but the most common include: Number 1. Depression, anxiety and panic attacks. Number 2. Suicidal thoughts or actions. Number 3. Switching between different personalities. A person with dissociative identity disorder will have two or more different identities that control their behavior. Number 4. They can experience blackouts, amnesia, and periods of time where they don't remember what happened. Number 5. Memory loss about important personal information, such as one's own name, address, or phone number. Number 6. Feeling detached from one's emotions and body, not being able to feel anything. Number 7. Hallucination. For example, hearing or seeing things which are not there. There are three main treatments for dissociative identity disorder. Number 1. Psychotherapy. Dissociative identity disorder is a condition that typically occurs in response to trauma. Treatment often involves psychotherapy, which helps people gain control over the dissociation process and symptoms, leading them back into their normal lives. Therapy can be intense as it forces patients to remember traumatic experiences from the past so they do not affect everyday life anymore. Number 2. Cognitive therapy. Cognitive behavioral therapy and dialectical behavioral therapy are two common types of counseling used to help people with anxiety, depression, or other mental health issues. The process involves changing unhealthy thoughts and behaviors through a series of specific steps that can be learned in sessions with a therapist. Number 3. Hypnotherapy. Hypnotherapy has been documented as an effective aid for those who have diagnoses like dissociative identity disorder. If you are experiencing stress or other personal issues that affect the way you treat your child, seek help. Talk to a trusted person such as a friend, doctor, or leader in your faith community and ask for assistance on resources like parenting support groups and family therapists. That's it for today. Hope you enjoyed this video. Don't forget to like and share this video and subscribe to our channel. Stay tuned for more fun videos for you. Thank you for Mindflux.